Good afternoon, everyone, and welcome in the name of the PerMed coordination team. It's a great pleasure to have all of you with us today. I think the interest in this information day was really impressive. We had about 1,000 registrations this morning for that event. That is really great. In the next minutes, I would like to give you a short introduction into PerMed. Yeah, first of all, we were lucky. We did not have to start completely from scratch, but we could build on more than 10 years of experiences of different initiatives on personalized medicine in the European context. It started with the CSA PerMed in 2013 that came up with the strategic research and innovation agenda, and that lays the basis for further initiatives in the field of personalized medicine. I would like to mention the International Consortium for Personalized Medicine, which is an exchange and communication platform, and which also came up with different recommendations to further develop personalized medicine, like an action plan or the vision paper 2013 for personalized medicine. Closely connected to PerMed and its aims is the European Research Area for Personalized Medicine, which is a joint funding initiative. And I guess the one or other would be or is already familiar with PerMed, perhaps as a funded project partner. During its 6-year runtime, PerMed funded 111 transnational and interdisciplinary project consortia and invested a budget of more than 130 million euros in personalized medicine research. Besides those both initiatives, we have a whole flower gem of coordination and support actions that were funded within the Horizon 2020 framework. CSAs that are comprising the PerMed family are on health economics, on clinical trials and personalized medicine and on prevention. But we also have CSAs focusing on personalized medicine in European regions and those that work on international collaboration on personalized medicine between Europe and Latin Caribbean countries, China and Africa. The experiences and results of PerMed and PerMed, but also of the PerMed related CSAs strongly supported the development of the recent strategic research and innovation agenda for personalized medicine that was published last year in April. And you're more than welcome to have a look into the document for further details. The main idea of this RIA is to support PerMed and aims to ensure that the long-term vision of PerMed is put into action. Over that, this RIA is also meant as a support for a wide range of other stakeholders and experts to further develop programs, activities, and research towards personalized medicine and care, and also to prevention. The key message, or one of the key messages of this RIA, is that to foster personalized medicine, not only interdisciplinary research is needed, as shown here in the blue area, but also successful and rapid innovation steps in cooperation with the private sector are needed, and fitting implementation settings need to be in the focus. Besides those 3 key areas, there are also cross-cutting aspects that currently are responsible for bottlenecks in the development and implementation of personalized medicines and that need to be addressed, therefore. Overall, we always talk about the personalized medicine system of health. And what we mean is that the results from one area that I talked about to the next steps have to feed into the next area and also vice versa. So we need to form a cycle of knowledge and make sure that insights flow into both directions. And therefore, when we talk about personalized medicine, we see it more like a value continuum than like a value chain. And that idea is also reflected in the actual logo of PerMed, which is a Möbius band. And you already see the three colors of the key areas here. And in the middle is a play button that is meant to put personalized medicine into action. So coming to a few facts about PerMed now, European partnerships are a key instrument in the Horizon Europe framework to align research programs in Europe and to support the delivery of the EU priorities. PerMed is one out of 9 planned European partnerships in the health sector within this first framework of Horizon Europe. The European Partnership for Personalized Medicine comprises 54 partners, which are mainly national or regional funding organizations and ministries, but we also have foundations on board, one research infrastructure, BBMRI, and EIT Health, who supports us in innovation and implementation steps. Total resources of this partnership are around 375 million euros. The partners commit about 275 million euros, and the European Union will contribute around 100 million euros to this co-funded partnership. Interesting for you is that we plan over 80% of resources to support third parties, either via joint transnational calls like this one. We plan 7 annual joint transnational calls, but also other funding measures, calls, events, and activities in support of personalized medicine research, innovation, and implementation. PerMed's runtime is 10 years in total. We have a 7-year implementation phase and afterwards a 3 years of phase out, where we focus on monitoring of the partnership achievements, including, of course, monitoring of the funded consortia, and where we will have other measures to guarantee sustainability of PerMed. Here I give you an overview of the PerMed structure, and you already see by the color coding that the personalized medicine system of health is reflected here. We have in blue the main funding arm of PerMed, personalized medicine research related funding and support. Here we have the implementation of the joint transnational calls, but also of other calls like networking calls and etc. We have a specific work package on innovation, which aims to maximize the impact. And the key activities here are the PerMed radar and the PerMed accelerator. Then we have the work package 4, which tries to support and facilitate implementation of personalized medicine by different activities. Important is also here that awareness and information of end users needs to be given. That's a very important step. And then we have here the cross-cutting work package 5, which supports PerMed on the one hand side, as PerMed will be an independent initiative from now on, independent of PerMed, but will be supported by PerMed. And other tasks of WP5 are, of work package 5 are transnational, interregional and international collaboration and the reach out to other important stakeholders for personalized medicine like medical societies or European research infrastructures. Over that we have of course also a coordination and management work package that is necessary to manage over 50 partners. So in the end, I would like to come to the actual status. PerMed's official start was in November 23. We worked on the necessary formal steps the last 2 months, and in parallel, work package 2 was very active and developed the joint transnational call 24, which was launched on the 2nd of January. Thanks a lot to the work package 2 partners, especially to the team around Monika Frenzel at ANR, who really put a lot of effort into the work, into the joint transnational call to get it flying within such a short time frame. Thanks also to the funding organizations who already committed to the JTC24. Yeah, what are the next steps for EP PerMed now? It is to the main focus for 24 will be to set up the governance bodies and the working structures. And important for the participants today is that events and JTC independent calls are planned from the year 25 onwards. Yeah, and with this, I wish you all an informative event today, and thank you for your attention.
Dear consortium members, distinguished guests, ladies and gentlemen, on behalf of the European Commission, I would like to welcome you to this information day on the launch of the first EP PerMed joint transnational call, which is expected for this year, 2024. As you already know, the European Commission has started to fund personalized medicine projects more than 12 years ago. And to date, we have provided, I think, more than 3 billion euro in medical research funding to this area. We have done this because we are convinced that this is one of the main avenues in medical research and clinical practice for years to come. As a recent sign of the importance of the field of personalized medicine, I can say that 3 European member states in a row have been convening presidency events related to it. In June, we had a conference in Stockholm under the Swedish presidency. In October, a second one in Valencia by the Spanish presidency. And Belgium now will convene one in Brussels this May 2024 under their own presidency. We think that this attention from high political levels is well founded, as we have now arrived at a time where many of the advances resulting from scientific efforts of the past decades have reached maturity and can be effectively applied in healthcare practice. If we aim to increase health satisfaction for our patients and their families, to deliver more effective treatments, if we aim to use in the most efficient ways our limited resources, then achieving optimal results through targeted prevention, diagnostics, and therapies is the way ahead. You may be already familiar with our past personalized medicine projects or coordination and support actions such as SAPIR, PerMed, Agents for PerMed, so on, or flagship initiatives such as the ERA PerMed or the International Consortium of Personalized Medicine just mentioned recently. Now, we are very happy to witness a major move towards a more ambitious and far-reaching initiative, which is this 10-year partnership on personalized medicine. It is with this large partnership of over 335 million euro, I can see now more than 370 total resources combined, that we aim to bring in an accelerated way the progress of the personalized medicine area to the clinics and the public. Now is the time to say that personalized medicine is not a fancy dream of a few researchers. It's here and will be part of our reality. It is the time to say that this is not a medicine for the rich, it's the future for all EU and world citizens that expect to receive high quality healthcare from their national health systems. And it's for you, as future applicants to the EP PerMed calls, to participate to this journey and help make this dream come true. This very large and valuable consortium, pulling together impressive resources from over 20 member states and third countries, plus the European Commission, and building on the past teamwork that has been just mentioned. So this consortium was able to mobilize and propose the first joint transnational call already this beginning of January 2024. As you will see from the presentation and discussions to follow, it will offer opportunities to researchers, academics, enterprises, ONGs, patient associations, so on, to contribute their expertise towards the identification or validation of targets for personalized medicine approaches in view of better detection, quantification, and monitoring. I can only praise the excellent start of this consortium, and I will give now the floor to those who have put so much work and dedication to it, and I look forward to a stimulating discussion. Thank you very much.
I have been working at the Research Council for about 11 years. I'm a biochemist as training, and all the way I've been working in the ERANET and EuroNanomed, and now in the partnership ERA for Health. So I will tell you about our RI guidelines developed there and how it can be useful for you. So just as you know, ERA for Health is also a partnership. We started in November 2022, and we have a non-thematic partnership that really find the priority areas to advance health research and develop innovation. So what is RI, Responsible Research and Innovation? It's really a way for funders to that need to ensure the legitimacy of their research and innovation investments. And RI is a way we can respond to that. You also have heard about co-creation, citizen science, open science, and they are really a bit other responses or way to do this. And I will come back to a bit more details very soon. But first, I would like to mention to you how Horizon Europe talk about responsible research and innovation, because it has developed a little bit since Horizon 2020. It's not exactly the same. It is mentioned, first of all, as a specific operational objective that RI should be taken into account. And you see it as a part of the regulations really mentioned clearly and specifically. So that means that this method is relevant for all calls in Horizon Europe. As the partnerships are projects in Horizon Europe, we do take responsible research and innovation very seriously in ERA for Health. And we have a specific pillar 3, that it has different transversal activities where we look at the funding methodologies and their sustainability, the ecosystem and capacity building, and also how we can do responsible, ethical and open science. And really the RI into our ERA for Health project is promoting cross-cutting training for stakeholders and do develop organizational practices. So we have a separate work package that implement RI in ERA for Health. Of course, PerMed doesn't have the same kind of way to implement responsible research and innovation, but it doesn't mean that what we do can be relevant for you. Yeah, I'll skip this one. I will explain you how very soon. A little bit more about what RI is then. It's a way that you could, in an inclusive and deliberate way, address the social needs. And you could try to avoid undesirable effects. For example, Horizon Europe is very clear on the do no significant harm principle. And you could also integrate responsibility into your practices. You can do it by engaging stakeholders and really not outsource the responsibility to others, but all take some responsibility. And in ERA for Health, we've been clear on that we connect responsibility to the both social, environmental, and ethical or political issues in the projects. Maybe I haven't been clear on this, but so we, as funders, take in RI in our project to be responsible, and then we also ask the projects we fund to do the same, to do what they can to be responsible in their projects. And to support and help the projects, we develop the RRI guidelines, because we see that you always have to look at your responsibility in a national context, in a disciplinary context, in a scientific context, and in the funding context. And you have to tailor your responsibility in these contexts, depending on what kind of research you do, the field of research, and the type of research that you do. Everything will impact the way you look at your what you have to take care of in your responsibility thinking. And I looked at the overall objectives of the European Partnership PerMed, and the main overall objectives really support thinking or implementing RRI methodology in the projects that are funded. So that's why you could use our RRI guidelines developed when you plan and design your research and innovation projects. This was not a very great slide, but anyway, the important here is that it's crucial for health research and innovation to maintain and improve European public health. And it's really, in this context, easy to acknowledge that science is not separate but from society, but a part of it. And RRI is to look in the potential direction that research is taken, who might benefit from it and who might not, and consider the potential social, environmental, and ethical issues that are there. So this is I just put this slide because it's really a core text that says what RRI is for ERA for Health, at least. And you find the same information in the guidelines we have developed. So this slide also is information that you find on the RRI guidelines, and the links you see here, you will find in more information. So go to the ERA for Health website and you find the ERA for Health RRI guidelines, which I have made a screenshot of here. And the next slide I will see you, I just want to show the core, but what should you actually do pages, and it's 3 pages. It's not enormously long. So this is really what could be useful for you as researchers and proposal writers. This 7-point list of things that you might be relevant for you to think about when you design your project. And you find also aspects around ethics and open science and environmental thinking and so on in this list. It's not a full list, and it definitely can be other things that is relevant for your projects. So please keep that in mind. Yeah, I think that was long enough for me. Here you see my email if you have any concrete questions about our guidelines, and please find our guidelines on the webpage of ERA for Health, and you learn more about RRI in general and about the health science approach to RRI. Thank you.
Okay, so hello everyone. Thank you very much for joining today for the Information Day for PerMed Joint Transnational Call 2024 PMTargets. So today we would like, as the joint call secretariat, which is held in ANR this year, will not be the same next year, we'd like to present the first call, and it's our pleasure to do so. So just a quick reminder, PerMed strategy for the calls and the 7 calls that you will have during the 7 years, the 7 next years, is based on the strategic research and innovation agenda. So have a look at it if you want to see scope of this call and the global strategy for PerMed, which is very interesting to see. So also as a reminder, PerMed has been voted right now, and we have about 375 million euros to spend over the 7 years to come. So it's a really big project, and we're very happy with it. For this particular call, so 2024 PMTargets, we have 38 funding agencies, funding organizations participating to the call, which represent approximately 23 countries and 10 European national regions. So it's a big partnership, and it's funded around 45 million euros for 2024. So we might actually have an important number of projects that could be financed, which is very great. I just put there a little agenda for you to see the deadlines that are coming, but it's already published on the website for PerMed. So it's just as a reminder, and everybody knows, of course, that today is the 15th of January. So you can find this information on the website. More generally, all the information that you need about PerMed are going to be on the PerMed website with the link just here. This presentation also, because we have had a lot of questions already about that, will be available on the website. Will be available online, and we'll send a link for the presentation via the newsletter. So please register to the newsletter. It's also important for us for the follow-up of the projects, and we can contact you very easily via the newsletter. So for the PerMed, I don't think yet that you see my pointer. What pointer? No? Okay. It's not a problem. So I put also the link for the electronic submission tool that is obviously absolutely important. But it will be, it's important for me to speak about it right now, because usually people have in mind the form, the PDF form that you will have to send. But the PT outline is also a place where you have to fill a lot of information about you, about the coordinator of the project, about the partners of the project. It's a lot of time. So I really wanted for you to see it right now. On the website, you will also find all the information about the call, the funders, the call documents, a short summary of this call, the eligibility criteria, and also the partnering tool, which is the tool you can use that you will see at the end to find a partner or to find a consortium if you are in need of such information. Okay, let's go on. So just a screenshot of the website, all the documents you need, most of the questions you will have will be answered by reading the call text or the guidelines for applicants or the pre-proposal form. So it's very important, and I cannot stress this enough, that you take time, I know it's long, to read all the documents, and also to register if you want to publish, to send us a proposal, to register to PT outline really fast in order to see everything that you have to do for the proposition and how to build a consortium. And if you have any remaining questions, please do not hesitate to contact us, but also very important to contact your funding agency, your local funding agency, because some funding agencies, as you will see, have specific rules for the countries. So it's very important that you contact both of them. So now into the core of the subject about PerMed JTC 2024. I just wanted to show you the aims, the overall aims of this call. So I'm sorry, it's reading the slides, but I have to be very factual, as we say. So we want to identify or validate targets for personalized medicine in human health in combination with the development of companion biomarker to allow for the monitoring, to allow for monitoring of treatment outcome and patient stratification. So the call is really focusing on target validation or identification and not only on biomarker discovery, and studies that will focus only on the discovery of biomarker will be considered out of the scope. So also it is this call is dedicated to encourage and enable interdisciplinary collaboration by combining preclinical and clinical research in transnational projects and multi-actor research, including end-user perspective analysis to empower the implementation of personalized medicine. So we really want to stress the fact that it is important for the proposal to take into account the end-user perspective, for example, patient perspective. It is also encouraged to include in the consortia patient organization, for example. So really, we want to stress this out. We want also to encourage cross-sectorial collaboration by also including private sector. So if you want to include in the consortia a partner which is in fact a company, a little company, a medium company, or a large company, it's okay for us. So the scope of this JTC 2024, if some of you are aware of what was done before in PerMed with the modules, we wanted to change a little bit this philosophy, this strategy, and we established a scope split into 2 stages. The 2 stages are not mutually exclusive. Proposal can have some stage 1, stage 2, but the stages define the overall scope of the call in which all the proposal must fit. So the stages are first the identification of novel target for the development of a concrete and feasible personalized medicine approach based on a clearly circumscribed biological or clinical hypothesis in combination with companion biomarker research. So applicants are advised to use existing clinical data as basis for target identification. So published databases, for example, are very advised to be used. So stage 2 is the development or validation of already known but not yet established target for personalized medicine approach in combination with accompanying biomarker research. This includes target validation in vitro and in animal model, so proof of principle study, early pharmacological and toxicity tests, and if feasible, exploratory clinical studies to demonstrate clinical applicability. So this was very important because in this year call, we wanted to allow the funding of small-scale clinical trials, and we wanted to say it here. So these approaches are complementary, but once again, they are not mutually exclusive. And if your proposal fits into both of the stages, the proposal is still valid, of course. So we encourage the proposals in all research area, in all disease area. So this point is free, but the consortia are required to start from a relevant clinical and unmet need, and to include activities that support a comprehensive and effective uptake of the development, the developed personalized medicine approach, in clinical practice. So in terms of eligibility criteria, because we've seen the aim, the global aim, the scope of the call defined by the 2 stages. In terms of eligibility criteria, we are really open this year. We accept academia, public health organization, also private sector, and patient organization. As you can see, the patient organization are in a different color because not all the rules that apply to partners apply to a patient organization. In order to facilitate their involvement in all the consortium, we really wanted to let them a little bit more free. So each collaborative project should represent the critical mass necessary to achieve the scientific goal of the work proposed and should clearly demonstrate the added value of the cooperation. So I'm sorry, I have to read a lot of my slides because this presentation will be published and I wanted everybody to have all the information. So I read it a lot. So, okay, for the eligibility criteria, I think it's quite clear. I wanted to have a little sketches in order to explain the composition of the consortia because I know that sometimes it's very difficult. So the minimal consortium for this European partnership call is necessary based on different partners that are independent in different countries. So the minimal consortium you can have is three partners in 3 countries. If you want to add a self-funded partner, which is represented in black on the right, it is absolutely possible, 1 per consortia, and this partner must be added in a already minimal consortium, so 3 partners in 3 countries, plus 1 self-funded partner. So I put back the rule just under it. So the country must be EU member states or associated whose funding organization participate in the call. So you have a list of funding organization that is in the call text. If your country is participating in the call, you will find your funding organization in the call text. If your country is not participating in the call, but you want to join a consortium as a partner, it is possible, but you have to join the consortia as a self-funded partner. Also, each project, each proposal must have a coordinator. This coordinator must be eligible, meaning it must be from a country that is participating to the call and eligible in its local funding organization. Monica, you will tell me if I'm wrong, but a person on its own fund cannot be the coordinator of a project. Okay. So, well, this is it. Do not hesitate. I see there is a lot of questions, but do not hesitate if anything is unclear to tell Monica, to tell me to stop a little bit. So, in terms of the rules, so the maximal composition of the consortia is 6 partners. So here I put 6 partners in 6 different countries, but it can be a little different. As you can see here, for example, one rule we have, which is an important one because it's also the one that applies to the patient organization, is that we don't allow more than 2 partners in one funding organization. Meaning, if the fact that 2 people are funded by one funding organization is the maximum. But this can apply in different countries. So in one consortium, you can have in 2 countries, 2 people, 2 partners, funded in one funding organization. So 4 partners funded by 2 funding organizations in 2 countries, for example. But yes. The maximum number of partners in a consortium can be 7, if and only if there is 3 people in one country, but the rule is we must have at least 2 funding organizations in this country. Why? Because of the previous rule, no more than 2 people in one funding organization. Okay, is the chat okay?
Yes.
Okay, let's continue. So I put here an example of consortium that is possible with 1 person funded in one funding organization in the first country, the second country with a self-funded person, so no more self-funded person, partner, if we allow 1 self-funded partner per consortium. In the third country, you see that 2 people are funded by 1 funding organization, which is fine for us. And in the fourth country, you have 3 people in the call. So, and the total of partners in this consortium is 7. So you are allowed to have 3 people in one country. And all the rules are validated here. So for the patient organization, only one rule for their integration is the fact that we don't want more than 2 people, 2 partners funded in one funding organization. So you can include the patient organization only with this rule. But for the rest, you are free. Meaning, if you want to have 2 patient organizations from one country where there is already 3 people, it's okay. If you want to have 10 patient organizations in your consortium, it's okay for us as long as 2 people are not funded, the 3 people are not funded in one funding organization or more, only 2 people. So you have in the call text, resume, a summary of what I just said for the pre-proposal and the full proposal form. I didn't set it here because it's not the topic for the pre-proposal, but you can add one partner between the pre-proposal for the project that have been selected and the full proposal, thanks to the widening protocol procedure, allowing for an underrepresented country in the pre-proposal acceptation selected proposal, allow this country to add a partner into a consortium. So I said it a bit earlier, but it's very important for you to notice this. The funding organization may ask the local partners, so the country partners, different things than the general PerMed goal, meaning that you can have specific rules per country or per funding organization, and you have to take this into account. Everything should be noted is noted in the call text, but please contact your funding organization and ask them very fast what they need you to do for the proposal. Because as you can see, for some countries, you have to create other documents. For example, you have new deadlines that may appear, and it's very important for you to take this into account for the proposal, because if one of the partners is rejected, the proposal is rejected. Also, I wanted to highlight here, not specifically Denmark, but specifically the eligible cost, for example, because all the country in your budget construction, all different funding organizations may have specific rules that apply. So please, once again, be careful to that. Really be really careful in looking at what are the eligible costs, and if there are some specific regional new rules and eligibility criteria that may apply to you and not to the other partners. Also, as I was saying, in this call, we wanted to add the possibility to fund small-scale exploratory studies, but it has to be small-scale because in terms of feasibility, it has to be feasible. But we can finance small-scale exploratory studies. So in terms of constitution of the proposal, as we were saying, we really want you, if possible, to involve the end user in your proposals. So this includes the patient organization, but patients also, citizens, healthcare provider, health and social care services, etc. The goal really is to raise awareness, share knowledge, improve dialogue between researcher, healthcare provider, policymakers, really to have an integrative project in terms of society and research. We really stress this a lot. We really want the consortium to be complete in terms of research, clinic, implementation. It's really important for us to have all the points of view. So your proposal also need to include sex and gender analysis or analysis on underrepresented population. It's something that we are really careful of. So we have also a policy of scientific data open access. So you must clearly describe all the tools, the technology, the digital support that you are going to use in the project, as well as the methodological approach. So this includes information on how the data from different sources will be combined, how different data streams will be merged, and how the primary outcome will be meaningful across different institutions. So take this into account, because once again, it's something that requires a lot of thinking, a lot of work, but it's very important for us that you do this for the proposal. Thanks to Cecily, also you've seen that we wanted to integrate this research, responsible research, innovation, and ethical compliance. So I hope you took into note that you can use the ERA PerMed guidelines for RRI. It's very important for us that you do so. Once again, thanks a lot for the presentation, Cecily. It was very clear. In terms of eligible annex, because it's always important to have and keep in mind the things that might be added to a proposal. So you have only 5 eligible annex, so no other annex will be accepted than this one for the proposal. One is very important. I just put into color here the stages. So here it's mainly at the full proposal stage, except for the Annex 5, which are the supporting letters and the endorsement letter. But for the rest, it's mostly the full proposal. But I wanted to put it here because ethical self-assessment, for example, if you are selected for from the pre-proposal to the full proposal, you cannot start a project and have a pre-proposal without thinking about ethical and self-assessed ethical part in your project. So it's very important for you to think about that soon enough. And we take a huge we make a huge importance in those documents. So be careful with that also. Okay, so evaluation criteria are available to you in the call text, page 17. The evaluation criteria are really clearly exposed. I will not expose them here because it's a little bit too long for a slide, but it's in the call text, page 17. Please read them with caution before starting to write your project, because it's very important for us that those are clear in order for your project to be evaluated easily. It's very important for us. So as I was saying, you have a PDF dossier, PDF file form to complete, which usually takes a long time to build with your partners. You also have the PT outline form to build, which is also long. I put you a screenshot just after this, but once again, be careful because both of them are time consuming, and we really advise you to do them at the same time and not really at the end for the PT outline form. So the PT outline, the link is available on the website. The PT outline is presented this way. So you can see on the bottom left of the screen, the EP PerMed 2024-013. Here are all the tabs that you will have to fill. So this is the first tab, the general information, with already a few questions. Then the second one, this is the end of the first, the general information. The project coordinator and project partner tabs are the biggest one with 57 entry. Not all of them are compulsory, depending on your consortium, but usually you will fill them all. It's very long, so please register to PT Outline very fast if you want to send us a proposal, because you will see that it's important to start soon. Okay. Also, we now have a partnering tool, allowing you, as I was saying at the beginning also, allowing you to find either a partner or a consortium. So how does this partnering tool work for this year call? So you will be able to see the profiles of other researchers, but you must complete and validate yours. You also must indicate your expertise and how this could contribute to a potential proposal. And to be, you have to be sure to be specific enough to give others an idea of your plan and expertise, but do not include any confidential information, of course, because it will be public for those who have a profile, of course, but it will be public, so do not put any confidential information in there. So it's dedicated for those who want to find a partner and or a consortium, but I just said that. So how is it built? So once you register to the partnering tool, you will access this tab. So the contact data. This is very nice for this year because you will actually build your profile, and your profile will be saved for next calls. What will change is the second tab, so the PerMed JTC2024. This will not change or will not be conserved for the next calls. It will only be for this one. But be careful, because when you finished building and filling your forms, you have to validate to activate your profile. Otherwise, it will not be seen by anyone. So if you want to use this tool, be careful to activate your profile at the end and to fill it enough so people can recognize your competencies, and not too much so you don't say anything confidential in the publications. So at the end, you will see that we did the already present researchers, because we didn't want it to say it out loud, but it's something like that. So you will have a page on which you can search for any published consortium or any published partner, and you will have the freedom to contact them and maybe to find partners. So do not forget, once again, I have to stress it a lot, to read carefully the call text and the relevant central and regional, national eligibility and budgetary criteria before starting the proposal, in order to check if you as a partner and the consortium as a whole fulfill the call formal requirements. Once again, if one partner is not eligible for the call, the consortium cannot be is not eligible for the call. So it is recommended to contact your respective funding agency prior to submitting your application. For any question, you can join us. It would be our pleasure to answer to you either by phone or by mail. The mail is preferred in order for us to do the follow-up. And of course, your proposal must clearly outline the personalized medicine perspective for this call. So we are looking for receiving your application. It would be our pleasure, and we're open to any questions, but I think we already had a lot.